Now let's discuss about one of the salivary gland, that is the parotid gland. So here you can see in this picture, this is the position and this is the shape of the parotid gland. So it is a wedge-shaped gland lying on the side of the neck between the mandible and the mastoid process. So here this is the mandible as well as the mastoid process is behind. So in between them will be the parotid gland just in front of the ear. Extension above, it will be extending up to the zygomatic arch. So this is the zygomatic arch. Up to that, this gland will be extending above. Below 2 centimeters below and behind the angle of the mandible. Here will be the angle of the mandible between the ramus and the body. Here will be the angle. So just it will extend below it up to 2 centimeters. Anteriorly, the gland lies posterior part of the masseter. So here is the masseter muscle. So it lies behind, posterior to the masseter muscle. And posteriorly, the gland overlies the mastoid process, and posteriorly this gland extend up to the mastoid process here. So this is the gland and this is the position of this gland. The borders and its relations. The upper border is concave and related to the external auditory meatus. If you can see here, so the upper border is concave here in behind, because it goes below the ear and extends up to the mastoid process. So it is concave above, and it is related to the external auditory meatus. This external ear, this opening of the external ear, this is called as the external auditory meatus. So it lies below the external auditory meatus. Anterior border is convex and there are many structures leaving the gland beneath its border, which can be enumerated from above downwards as follows. So if you see here, anterior border, so this is the anterior border. So this is the anterior border which is convex, and so it is almost convex. Okay, and there are many structures which will be leaving at the anterior border. So there will be many structures which are extending beyond this anterior border. So what are the structures from above downwards? It is mainly the branches of the facial nerve, the temporal. The first one will be the above downwards will be the temporal and zygomatic branches of the facial nerve. If you, this is the facial nerve here, so it has two main branches, temporofacial as well as the this is the cervicofacial. So from the temporofacial you can see the temporal branches as well as the zygomatic branches. They have been given in different colors, but they are all nerves. Okay, so these are the temporal branches and these are the zygomatic branches of the facial nerve. Then the transverse facial artery, there will be an artery here which will be the transverse facial artery, which will be supplying the muscles of the face along with the facial artery, main facial artery here. Okay, then we have the upper buccal branches of the facial nerve. So here will be the buccal branches. There are upper buccal branches as well as the lower buccal branches. In between these upper and lower buccal branches, there will be something called as the parotid duct. Parotid duct is that duct which will be draining the secretions of this parotid gland into the oral cavity. So you can see here, this is the parotid duct which is extending again from the anterior border of the parotid gland. Then we have the lower buccal branches, as I said, they will be upper as well as these are the local buccal branches. Then we have the marginal branches of the facial nerve. So there will be marginal branches. Then there are also cervical branches which will be supplying the neck. So here will be the marginal mandibular branches of the facial nerve. Okay, marginal branches. So these are some of the branches of the facial nerve which will be extending from the anterior border. The posterior border, this is the posterior border here now. It is almost straight and rests on the sternocleidomastoid. This is the sternocleidomastoid muscle. So it extends up to the anterior border of the sternocleidomastoid muscle, and it is related to the greater auricular nerve. There will be a nerve which will be running behind here, so it will be related to the greater auricular nerve, and it extends up to the anterior border of the sternocleidomastoid muscle, this one. Medial border is it forms the apex of the wedge and it is related deeply to, so the medial border will be deep inside. So you can see it in the cross section. Let's see if there is a cross section. I will show you the medial border which will be deep inside, It forms the apex of the wedge and it is related deeply to the side of the pharynx, deep inside of the side of the pharynx, carotid sheath and styloid process. The surfaces of the parotid gland are three surfaces. Then there is the lateral surface, there is the lateral surface or the superficial surface which is near the skin. Then we have the anteromedial surface as well as the anterolateral surface. So there are three surfaces within this parotid gland. Relations of the surfaces of the parotid gland: laterally, as you can see, because it is just below the skin, it is related to the skin, parotid fascia, parotid lymph nodes as well as the greater auricular nerve and its branches. Okay, so superficially there are no structure except the skin, parotid fascia, that is the deep modified fascia, superficial fascia, parotid lymph nodes and the greater auricular nerve. The anteromedial border, it is related to two muscles. One is the masseter muscle. So anteromedial border will be related to this muscle. This is called as the masseter muscle. Then we have the ramus of the mandible. Deep inside will be the ramus. This is the body of the mandible, and here straight vertical part that will be called as the ramus of the mandible, and the medial pterygoid muscle. Deep inside there will be medial pterygoid muscle. So these are the structures which it will be in contact with the anteromedial surface. The anterolateral surface, it is related to two muscle and one bone. One is the sternocleidomastoid muscle, which you have already seen here, which is cut here. So this is the sternocleidomastoid muscle, which will be related to it deep inside. Then we have the mastoid process deep inside, and the posterior belly of the digastric muscle. There will be a digastric muscle here. Posterior belly of there will be anterior belly of digastric and the posterior belly of the digastric. So it will be the posterior belly of the digastric, which will be deep inside here, sternocleidomastoid here you can see, and the mastoid process. So these are the two muscles, the digastric, posterior belly of digastric and the sternocleidomastoid muscle, and the bone is the mastoid process. So these are the relations of this parotid gland. So here you can see the parotid gland, how exactly it is present. So this is the parotid gland here, and here you can see the mandible. This is a cross section taken from here at this level. So passing through the parotid gland and the masseter muscle. So here you can see the masseter, and deep inside we can see the medial pterygoid muscle. Within this gland, so there will be some structures which will be passing through this parotid gland. So what are the structures which are within this parotid gland? There are some arteries, mainly the external carotid artery. If you can see here, this is the external carotid artery. In other pictures we can see here. So this is the common carotid artery, and it gives two branches, external and internal. Internal will be going behind and it enters the skull. It will not give any branches. The external carotid artery will be extend here, and it will be giving a lot of branches, almost 8 branches. So this is the external carotid artery passing through this parotid gland. So this is the external carotid artery. Then which lies deeply and terminates into the maxillary and superficial temporal artery. So it will terminate by dividing into the superficial temporal and the maxillary artery. So the other two branches will be the maxillary artery and the superficial temporal branch. So here extending above, this will be the superficial temporal artery, and here will be the maxillary artery. Coming to the veins which are present within this parotid gland will be the retromandibular vein. There is a vein which will be passing deep to that and it comes out. So that will be called as the retromandibular vein. Okay, so there will be retromandibular vein, then the termination of the superficial temporal vein. So here is the along with the superficial temporal artery, there will be superficial temporal vein which will be draining the skull. Then the maxillary vein. So the termination of the maxillary vein and the superficial temporal vein, and here you can see the retromandibular vein. Okay, all these veins will be draining and they will be passing through this parotid gland. Then we have the nerves which will be passing through this. One is the greater auricular nerve. So if you can see here, one of the nerves will be the facial nerve, which has been shown here. Other nerves have not been shown. So this is the facial nerve which you have seen, which will be dividing into multiple branches. So here in the previous pictures you have seen the facial nerve dividing into 5 terminal branches: temporal, zygomatic, buccal, marginal as well as cervical. So this is the facial nerve which will be passing through this gland. So that is what has been shown here. Along with that, there are also the greater auricular nerve as well as the auriculotemporal nerve. this also passes along with the facial nerve through this gland. So we have the arteries, then we have the veins and the nerves which will be passing through this gland. So this is the simplification of the same thing. Here the nerve has been shown, the facial nerve with its branches, multiple branches, and here you can see the external carotid artery dividing into the maxillary artery as well as the superficial temporal artery. Here you can see the superficial temporal vein and the maxillary vein together joined together to form the retromandibular vein here. Now this gland has a very important duct called as the parotid duct, or it is also called as the Stenson's duct. Stenson's duct or parotid duct. So this is the gland, and this is drained by secretion of this parotid gland is drained by this duct called as the parotid duct. This is almost 5 centimeters long. It arises from the anterior part of the gland. So you can see here from the anterior part of the gland by the union of two smaller branches which unite close to the accessory part of the gland. So it will have two main branches which will be joined together to form the main parotid duct. Relations, it runs horizontally, it is running horizontally, not vertically, it is running horizontally a finger's breadth below the and parallel to the zygomatic arch. The zygomatic arch here, almost a finger's breadth below that will be the parotid duct. It runs over this muscle, this is called as the masseter muscle. It runs over superficial to the masseter muscle, and it pierces the structures from superficial to deep, that is the buccal pad of fat, then the buccopharyngeal fascia, buccinator muscle here, then it will be piercing at the level of third upper molar tooth, and it opens finally into the vestibule of the mouth. Vestibule of the mouth is the space between the teeth and the cheek, and it opens into the at the level of the second upper molar tooth, pierces at the third molar tooth, but opens into the oral cavity at the level of the upper second molar tooth in the vestibule of the mouth. So this is the whole course of this parotid gland. Blood supply is by the external carotid artery, and the venous drainage is by the external jugular vein, and the lymphatic drainage is to the superficial and deep group of parotid lymph nodes. And so this superficial and deep group of parotid lymph nodes are just over this part of the gland, and they finally terminate into jugular-digastric group of deep cervical nodes. That is, they will after draining into the parotid group of lymph nodes, then they drain into the main group of lymph nodes in the neck, that is the jugular-digastric group of lymph nodes. Coming to the nerve supply of the parotid gland, it has secretomotor. Because it's a gland, so it has secretomotor secretion. It is via the inferior salivary nucleus and to the glossopharyngeal nerve, and from there to the tympanic branch to lesser petrosal nerve to the otic ganglion, and from the otic ganglion to the auriculotemporal nerve. This will be the whole course of this gland. Here you can see here, this is the otic ganglion here, and you can see the glossopharyngeal nerve. Glossopharyngeal nerve has been shown here. And from there to the tympanic plexus here, then to the lesser petrosal nerve, from there into the lesser petrosal nerve, and from there into the auriculotemporal nerve, from there into the auriculotemporal nerve, and then it supplies the parotid gland. Sympathetic supply is via the superficial cervical ganglion and plexus around the external carotid artery. So there is a plexus of nerves around the external carotid artery. From there it will be supplying the parotid gland. Sensory supply is by the greater auricular nerve itself. So the greater auricular nerve will have the sensory supply for this gland. So these are all the details which we have discussed already. Coming to the applied aspect, the parotid secretions are semi-serous, hence stone formation is very rare in these cases compared to the other secretions. Here, because it is semi-serous, so the stone formation is very rare. Cialography is the examination of the parotid after injection of the radio-opaque material through its duct. If there is a blockage of the duct because of the stones, even though it is rare, or because of something else, then there is a procedure where the radio-opaque dye is passed and then it is examined. This is called as the cialography. The important feature of this is in case of mumps. There is a viral infection of the parotid gland called as the mumps, and in which it leads to swelling of the gland within its tight capsule. Parotid gland has a very thick capsule around it. So hence, if even there is slight enlargement because of the infection or something else, then there will be severe pain. So it is associated with severe pain and difficulty in swallowing. So whenever there is mumps, especially mumps are seen in case of children, which is nothing but a viral infection of this gland, and which leads to severe pain because the gland has no space to expand because it is totally covered by a capsule, and then it leads to difficulty in swallowing, and the child will keep on crying as well as he will not take any feeds. So this is in case of the mumps. So these are some of the important features of the parotid gland. Now coming to the submandibular salivary gland. So it has two parts, the submandibular salivary gland, the superficial part which is the larger part and the deep part which is smaller part. This is the second salivary gland which is present around the oral cavity. So this is the superficial part of the submandibular gland, and this is the deep part. This is called a submandibular gland because it is below the mandible, just below the mandible. Position and extension. Anteriorly, the gland extends up to the mental foramen. Mental foramen is here anteriorly. So this gland extends up to the mental foramen. Posteriorly, the gland extends to the angle of the mandible. So posteriorly it extends to the angle of the mandible, and from there the deeper part will begin. Above, the gland extends to the mylohyoid line. Mylohyoid line is the line where the mylohyoid muscle is attached to the mandible from inside. So that will be the extension above. Below, the gland extends up to the hyoid bone. This is the hyoid bone here. So it extends up to the hyoid bone. So this gland is also covered by capsule, and it is derived from the deep fascia of the neck. Capsules are usually the modified deep fascia which will be covering the glands. The surfaces and relations of the submandibular salivary gland. So here you can see this is from inside. So this is the mylohyoid muscle. So this is the mylohyoid line. This is the extent above. So it doesn't extend above this. So this is the mylohyoid line where the mylohyoid muscle is attached. So this is the superficial part, and this is the deeper part which you can see from inside. Coming to the superficial and surfaces and relations of the submandibular salivary gland, the first will be the inferolateral surface. Inferolateral surface is the external surface where it is in contact with the skin. The skin will be in relation the superficial fascia, deep fascia of the neck, as well as submandibular group of lymph nodes will be in relation to the superficial surface, this surface here. Okay, what you are seeing from outside. Then lateral surface will be the medial pterygoid muscle, submandibular fossa of the mandible, and the facial artery will be in relation to the lateral surface. Then the medial surface is the inner surface where you have the stylohyoid muscle will be there. This is the mylohyoid muscle. Stylohyoid will be coming from the styloid process. Then we have the digastric muscle as well as hyoglossus muscle. All these are in the medial surface, medial relation to this larger part of the gland. Relations of the submandibular salivary gland. Note, between hypoglossus and mylohyoid muscle, the following structures lies and also considered as medial relation of the gland. So there are other structures also which are considered as the medial relations of this gland. One is the lingual nerve, the submandibular ganglion, the duct of the submandibular salivary gland, which is in medial relation, as well as the hypoglossal nerve. The duct of the salivary gland itself also acts as, see if you can see here, this is the submandibular duct which opens into the floor of the oral cavity beside the lingula. Okay, so this is the submandibular duct which also acts as the medial relations of the gland itself. So this duct of the submandibular gland is also called as the Wharton's duct. This here you can see here the Wharton duct. It is also 5 centimeters long, just like that of the parotid duct, but it is much smaller compared to the parotid duct. It is much thicker. It arises from the deep part of the gland. So this is the deep part, this is the superficial part, this is the deep part. So it arises from the deep part of the gland. It is related superficially to the mylohyoid muscle. So superficially outside will be the mylohyoid muscle. However, the hyoglossus muscle is situated deep to that, because the hyoglossus will be muscle of the tongue. So it will be medial to that. Okay. It has triple relation with the lingual nerve. If you can see here, so this is the lingual nerve which is running down and it supplies the tongue. So this duct has a triple relation. If you can see here, it is arching and it is going initially laterally, then it goes medially. So it has triple relation with the lingual nerve. It runs first above and then crosses. So it runs above, then it crosses laterally and finally becomes medial to the duct in the tongue. So this is how the relation of the submandibular duct or the Wharton duct with that of the lingual nerve. Finally, as I said, this opens on the sublingual papillae in the floor of the mouth, just beside the side of the frenulum. So if you can see here, this is the frenulum here, just beside there is it will be opening on the floor. Okay. So the blood supply of the submandibular salivary gland is by the facial artery and the submental artery. So these are the two arteries which will be supplying this submandibular gland. Coming to the nerve supply, mainly the parasympathetic is by the chorda tympani nerve, branch from the facial nerve. So which will be the chorda tympani nerve of the facial nerve, which originates from the superior salivary nucleus in the medulla oblongata. Lymphatic drainage is by the submandibular group of lymph nodes and drains finally into the deep group of jugular-digastric lymph nodes. So here you can see the chorda tympani nerve. So this is the facial nerve here. So this is the chorda tympani nerve, which comes below, runs down, and this is the submandibular ganglion, and through this ganglion will be the supply to this submandibular gland, and this submandibular group of lymph nodes will be draining this gland, submandibular gland, and finally drain into the jugular-digastric lymph nodes. Next, coming to the sublingual salivary gland. This is also in the floor of the mouth, occupying the sublingual fossa of the mandible. So here you can see this is a small gland. So here is all the three glands can be seen: the parotid gland, this is the submandibular gland, and this is the sublingual gland. Just because it is called a sublingual, because it is just below the lingula, that is the tongue. So it is in the floor of the mouth, occupying the sublingual fossa of the mandible. Here will be the sublingual fossa, small fossa above the mylohyoid line, that will be called the sublingual fossa, and this will be occupying the sublingual fossa. Relations above it will be sublingual mucosal fold, a small thin fold of the mucous membrane will be there of the oral cavity, that will be forming the sublingual mucosal fold. Below will be the mylohyoid muscle. As I said, below will be the mylohyoid muscle, which will be. So this gland, sublingual gland, is above the mylohyoid line, and the submandibular gland is below the mylohyoid line, that you should remember. Medial relation, it is related to the genioglossus muscle, because the genioglossus will be taking origin from the geniotuberculus here. So this will be medial relation along with the lingual nerve as well as the submandibular duct also. This duct is also running medial to this gland, so it is also in medial relation. Laterally is the sublingual fossa of the mandible, that is the small fossa just above the mylohyoid line, which is a small groove on the mandible itself, the inner surface of the mandible. Posteriorly, deep part of the submandibular salivary gland. So posteriorly, if you can see here, you can see the deep part of the submandibular which is in relation. Anteriorly it meets its fellow of the opposite side. So because all these glands are in pairs, so it will be meeting anteriorly with the opposite sublingual gland. Coming to the blood supply, it is by the sublingual artery, which is a branch of the facial artery, as well as the submental artery, which is also a branch of the facial artery. So the facial artery will be supplying this gland. Nerve supply is again by the parasympathetic part, that is the chorda tympani of the facial nerve, which arises from the superior salivary nucleus. So you can again see here. So this is a facial nerve, and here you can see this is the chorda tympani nerve, and it is going all the way, and so it joins with the lingual nerve, and here it separates itself and goes into the submandibular ganglion. From there it supplies both the submandibular gland as well as the sublingual gland. Lymphatic drainage is again to the submandibular group of lymph nodes, and from there drains into the jugular-digastric, very similar to that of the submandibular gland. Coming to the applied aspect, stone formation is common in the submandibular salivary gland because its secretion is mucoserous in its nature. So this secretion, mucoserous, is the secretion of this gland, so it is much thicker, and even the angulation of the duct is above, it goes above and has to open. So that's why stone formation is much more common in this salivary gland compared to the other glands. So this is all about the three salivary gland, the parotid, submandibular and sublingual gland, and we have also discussed about the tongue, the oral cavity, structures of the oral cavity, like the lip, the cheek, everything. So this is all about the alimentary system, especially the beginning of the alimentary system, that is the oral cavity, the tongue, the lips, the cheek, as well as the three salivary glands, submandibular, sublingual, as well as the parotid gland. If you have any questions, you can write to me and I will try to answer them. Thank you very much.